Hi. Thanks for coming out. Name's Chris Loris. I am one of the homeless response coordinators for the city of Rutland. The other is
Megan Novak. Nice to meet you guys.
And clearly we know what we have here. Go ahead, Chief.
Hi, Brian Kilcullen. I'm the police chief here in the city.
Yep. And so tonight is going to be the first of at least two. Megan and I have been discussing, how the outreach went and didn't go for this event. So if you like speaking or listening to in a small group, that's what you got tonight. There's going to be another opportunity if you're more comfortable speaking with a larger group or want to come when we have one more that we're going to make sure we get flyers and that type of thing out for. Our purpose tonight is to discuss the homelessness situation, specifically with respect to its impact on Rutland and the characteristics of the population who is due to lose their housing due to state rules and statutory laws. On the 19th is the date, even though it appears people have already started to move out. It's the 19th will be the official date of the 80 days of maximum stays any one individual is allowed in the hotels. So I'll just give you a little primer on the way that works. I just came from a couple of homeless meetings today up in Montpelier, so I'm a little bit fried. And please, Megan, Chief, and anyone in the audience, tell me if I'm getting out over my skis and speaking in either acronyms or if I'm getting off the subject as I'm starting to do right now. So what's happening right now is the state of Vermont has a current rule supported by statute that states that all individuals who have applied for general assistance, that's in layperson's terms, that's the welfare system administered by the Office of Economic Opportunity through Department of Children and Families. There is an 80-day limit for one full year, fiscal year, starting July 1st through June 30th, where any individual who is taking advantage of the benefits of the general assistance program for housing has 80 days of motel vouchers they can access through that period of time, July 1 through June 30, with the exception of December 1 to April 1, where that is the time frame of the cold weather exclusion, winter exclusion, where anyone who, if even they burned their 80 days, can go back in and apply for and be able to utilize the benefits of the emergency housing system, which again for one more year will be the hotel system. That's one of the things we have learned, I did learn today, and actually learned 2 weeks ago, is that program is going to continue and we'll see no changes this winter. So in addition to the 80 days, there are 1,100 hotel rooms capped throughout the state, and there is a daily list put out from the Department of Children and Families saying in each district, which is their way of saying county, whether there is no housing availability, very limited, or available. And I won't give you the numbers on what each of those qualify for, but let's just say extremely limited and limited is less than 10 beds available within each district. Rutland, and I don't know what the current numbers of rooms are because the state has been trying to draw them down, especially at the Cortina. But I can tell you, before the budget was written, this would have been like March timeframe, of the 1,100 beds identified throughout the state, 700 of those 1,100 are in Rutland County, specifically Rutland City and Rutland Town. So in the next couple days, the individuals who started using their 80 days on the 1st of July will run out of their housing vouchers for the entire year, with the exception of December 1 to April. And at that point, the people can go back in if there's availability. The challenge, and this was articulated by the state today, by Miranda Gray, the Deputy Commissioner of Children and Families, said that there are several hundred individuals who have not accessed their 80 days yet because there hasn't been the availability statewide, the hotels statewide, to put those people into those emergency housing shelters, codename hotels. And as the people who have burned their 80 days move out of the hotels, they will be replaced by at least 300 is the number that was put out today, who will start their 80 days when this current cohort exits the motels. Other people who exit the hotel, so of the 800 who exit the hotel, sorry, not 800, of all the individuals who are exiting the hotels, they will not be able to re-access those hotel rooms, or if there are any available, until December 1. Regardless of disability, regardless of whether or not they're pregnant, regardless of whether or not they are kids, they will be, quote, on their own till December 1, and the state has no plans to prioritize the prioritized list. Currently, in order to qualify for a room, you cannot be able-bodied. And the term I have heard is that they use in the industry is ABOD. So if you hear somebody say ABOD and they're a state employee, that's code for an able-bodied person who does not have eligibility for housing at all. Because right now there's about 1,400 to 1,500 individuals who are eligible, and this is daily numbers from the state, about 1,400 to 1,500 people who are currently eligible, and there's 3,500 homeless individuals in the state. So you've got 2,000 bodies who are not eligible for the emergency housing. So they're going to continue to be in our community and other communities around the state. So that's the program where it is right now. And the discussions that are being had at a meeting I was at in Montpelier today is something called the General Assistance Emergency Housing Task Force, which was created in the budget bill as passed by the House and Senate and signed by the governor. And part of my work, Megan's work also on this task force, we represent the League of Cities and Towns. The league had one seat on that 13-person task force. They gave it, the league determined they wanted to give it to Rutland. Mayor Dunges is on the board of directors of the league. He's not here tonight, he had dual booked, but his right hand, Tyler Richardson, is here. And they said Rutland gets that because it's understood at the league and throughout the state that Rutland has been disproportionately burdened by homelessness more than any other community in the state. While Windham County and Brattleboro is suffering pretty badly, as is Burlington, Rutland by far has more than what some would say, and I'll be one of those persons who use the language that's not desired. You know, Rutland is a home where we have an unfair burden per capita in the state of Vermont and in the country. One thing I was planning to say first, so I'll throw it out now. It's recognized by HUD, Housing and Urban Development, the feds that deal with homelessness, that Vermont has the second highest rate of homelessness in the country, right behind New York State, and Rutland has twice the rate of homelessness per capita as the state of Vermont. Vermont, it's 50 people, 50.9, so 51 people out of every 10,000 individuals in the state of Vermont are homeless. Rutland, it's 113. These are the numbers there, come from the 2024 point in time report and the 2023 census estimation done by the United States Census. So that's where those numbers are arrived at. I did some quick looking at, couldn't find any other county data for the country, but we have in the Rutland County, so remember that includes the population spread throughout the entire county of Rutland. We have numbers of homeless at a rate that rival New York City, twice as much as Atlanta, Georgia, rival Sacramento, rival Oakland. So Rutland County has the same level of homelessness as what would be the top 25 cities in the United States. Those are, and those numbers came again from the point in time report as put out by Housing and Urban Development nationwide. So the question for Megan and I, as the homeless response coordinators working totally under a grant from the state of Vermont, I gave to Rutland to say, try to figure out what you can do in Rutland because the mayor asked for millions of dollars for a transitional housing facility for families only. And we've got say again?
I was just going to say, before we get into
Yes.
what we're doing with Rutland, maybe we should pause and see if there's any questions related to the statewide information that he's just shared with you guys. Are there any questions about the
And-
General Assistance Emergency Housing Program? Yes.
How is able-bodied determined?
Able-bodied determined.
Able-bodied is determined
Or
in a
not
negative.
able-bodied?
If you don't have a disability per Social Security, verified by Social Security, so you're on SSD or SSDI, there is also a state waiver that provides for a qualified clinician to assert that an individual and their disability or living circumstance puts them at risk, and they are allowed housing if they get that signature by the doctor.
So I'll identify myself. My name is Tia Polino, and I'm the Executive Director of Rutland County Health Partners, otherwise known as the Free Clinic. And we have seen those cases, and we have had them brought to us, to our office, and with requests for exams from a provider, one of our providers, and that's one reason why it was important for me to come tonight.
Yes.
To see if that was going to continue to be an option, if we should anticipate more individuals contacting us for that purpose. Even if they have maxed out of their 80 days, they could still get a waiver by having actively licensed clinicians and attest that they have some medical condition that would put them at high risk should they be unhoused.
Yes. So really good point that, so basically just reaffirmed that there are individuals who don't have Social Security disability waivers, so they're not on Social Security disability, don't have that eligibility that's met, so they will continue to use the waiver program. As a matter of fact, there was some discussion of that today, whether or not and how the waiver program and may be amended in the future. There were some individuals working with the state that asserted that the intent of the legislature was not being met by the waivers. Because I believe that, while not written is the intent, and there's 2 senators here, that the intent was to make sure individuals who had qualifying disabilities, my guess is probably equivalent to what the disability would be for Social Security, that they would be able to access it in the housing program, and would get that waiver while the individual applied for and had Social Security disability pending. But, and anybody wants to make any comments beyond question and answer?
Yeah.
This is for us to gather your input as well, your own experiences, what you've, go ahead, Megan.
Well, and so for right now, any comments, let's keep them at the state level, because I do want to give them some insight on what we're doing for Rutland before we dive into questions specific to the
I got
city.
Susan, then Greg.
So people who've used their 80 days and then winter comes, they qualify on a daily basis for additional for housing if there's availability?
Yes, but not on a daily basis. If they get into a room, they can stay there through the winter.
Okay.
That's not exactly true.
That's, what is that? Okay, sure.
Pass the mic over, so in case they want to hear on that. Right. So based on rule and statute, so John Longworth, I am the grant writer for COTS in Burlington.
Yep.
My understanding is that during the 80-day period, is that not on? How about now? Oh, there we go. Look at that. During the 80-day period, so the July 1st until December 1st, and then after April 1st to the end of the fiscal year, the 80 days is the maximum eligibility for any person regardless of condition.
Yes.
Right? And so if you have used your 80 days in the first half of the fiscal year, once the winter period is over, you have 0 more days until July 1st. Secondly, there is a prioritization system in place that's going to be used to help them manage the cap of 1,100 rooms that are available around the state. No more than 1,100 rooms will be used at any one time during the 80-day period. And so what that means is that people who are eligible for some of these high-risk situations like disability, having small children, being pregnant, fleeing for domestic violence situations, they'll be eligible for up to 80 days. They can be authorized for 28 days at a time, no more. The 28-day cap also exists during the winter with just the guarantee that if you make it to the first 28 days, you can do another 28 days and so on until you get to the end of the winter period. And when it comes to disability, in order to get under the room cap, the state had to lift the age of eligibility to, I think it's 55 and older with a disability. So if you are 35 and you have SSDI, you are not automatically eligible, right? Now, that doesn't mean you can't get a room. If there's rooms left below the 1,100 cap, those rooms are available on a night-by-night basis, can be authorized for up to 4 days at a time while somebody's status is verified, and then 1 day at a time, up until they expend the allotment that they have. And if for some reason priority folks fill all of the available rooms within the cap, there will be no night-by-night rooms available for anyone. And that, as long as I'm here, ask a question. Are you aware of anybody in Rutland County who has applied for the state's assistance fund to deploy additional shelter during the cold weather period in Rutland County?
No, I don't believe that's the case. I believe the city of Rutland, with 13 other organizations or municipalities across 7 counties, submitted applications for the $10 million that the state was allocating above the 45 million, plus or minus, like 43.9. And as I said, the mayor did apply for that for the transitional family facility, which is I'll say, you know, it's out there that it may be Loretta home, but that's determined by the land trust negotiating with the diocese, and that will only happen, and Megan's going to get to this, if all the wraparound services and supported housing specialists fall into place. But no, Rutland did not. But I'll say this, while Rutland did not apply for any of that 10 million for emergency shelters, I would contend that with Rutland's 700 hotel rooms and motel rooms, we are already housing that population at a proportion that is well above anyone else in the state, any other community. And there's been no commensurate allocation of resources, whether to the schools for the nearly 100 kids that are in the Rutland City and Rutland Town school system, and no additional resources for Rutland Mental Health to provide mental health services, or Rutland Mental Health through what used to be Evergreen for substance use services. And that's one thing that we need to recognize, that the state recognizes that no municipalities, nor the state, nor the providers have the capacity to manage and serve 3,500 homeless individuals in the state of Vermont. Back in 2018, 2019, and for 10 years prior, Vermont had 1,000, 1,100 actually, plus or minus, homeless people for any given year. And I'll say it, we did, as a society, a crappy job for those 1,100 people. And now we've got 3,500 people jammed into that very same pipeline. So, Ed, those are the numbers that that we are dealing with in this community. And any other comments, questions about the statewide? Sharon, then Billy. Oh, sure.
There's been discussion, the numbers may be off a little bit, that we have like 675 currently in Rutland City or Rutland County. And that number from here has been sharing that there will go down to around 200 when the change starts to occur with the hotels and the length of stays. So is the state looking at, we've been told that a number of individuals are not from the state of Vermont. We've been told there's folks from Montana, from all over the country that have come to Vermont because we are kind of generous with our Medicaid. So is the state looking at how when they're starting to decrease those numbers, because I'm assuming that's the purpose, they want to decrease the homelessness, what wraparound services are they doing to help relocate folks back to wherever?
I think it's all anecdotal, if that at this point, but within the emergency rule itself, and I can't tell you whether or not it's in statute, but within the homeless, emergency shelter, emergency housing, emergency order, anyone who is living in Vermont can access general assistance. The definition of living in Vermont written down in the rule is living in Vermont, if a person is living in Vermont, that means they are a resident and are residing in Vermont and have an intent to stay in Vermont. And both providers, advocates, and the state recognize that that rule is based around intent. And if an individual, whoever, whether they've been living in Chippenhook for 20 years and says, I intend to be in Rutland, or intend to be a Vermonter, even though they've been here for 20 years, yay, they're a Vermonter. If you have an individual come from another state and they say, I have an intent to live in the state of Vermont and I am a resident because I now have a place in a hotel, they are authorized general assistance housing. It's not dissimilar from the standard for registering to vote. If you have an intent to stay in Vermont, then you are a Vermonter. So to your point, if individuals voice to a district coordinator, that's the AHS district supervisor, in our case in Rutland and Bennington County, it's Adam Sansick, who as far as state employees go, is ACES. He's highly competent, highly functional, and really good at what he does. The district supervisors have the authority to use general assistance funds to relocate individuals back outside the state if they choose to go to where their support structures are, or family, or anything else back outside the state.
And that's not to say completely that there's nothing that the state's working on. We don't know that. You know, our main job is focused on Rutland, and so the information that we have about statewide activities happening is really coming from our place on the General Assistance Emergency Housing Task Force. So there may be some things in the work that we are not aware of. Yes.
Megan, thank you for doing this, Chief, and thank the aldermen who are here and the two state senators. How we get here? Is there a plan to get us out of this? Dovetail what Sharon was saying about relocating folks back into their own home community, if you will.
And there are individuals from Newport, there are individuals from around the state that are living in Rutland right now simply because there was a hotel room available, and that was the only hotel room available in the state of Vermont.
Yeah.
And that's a function of, as I said at the Board of Aldermen for these folks a couple of weeks ago, that's a function of the hotel owners in the state are the ones who are driving state policy. If they choose to enter into a contract with the state of Vermont for the $80 a month now, what used to be $80 a night now, what used to be $135 a night, the individual in need of services, in need of housing, if they're told, we can get you to Rutland, we have a slot available at the Cortina Inn or at the Quality Inn, all you have to do is get to Rutland and you'll have that apartment, or that hotel room over your head. That's how we got to where we are, is the state during the pandemic, for all the right reasons, determined that individuals who did not have a room over their head, a roof over their head, would be authorized hotel stays through the voucher program. Many other states, many other cities did that through the pandemic. Vermont, according to one of the national organizations that is working with Vermont on homelessness through DCF, has said that there's no one else doing it now. We're the Lone Rangers.
And to kind of add to that, I think to answer your question, how we got here is that the state has been responding to an emergency year after year, and it's remained an emergency. So part of what we're tasked to do in Rutland is create, and our only deliverable that we have at the end of our contract is to create a strategic plan to respond to homelessness. So a lot of the work that we're doing is more focused in the future. We're going to create a plan that's due April 2026. So anything that is developed within that plan isn't going to be implemented until after that date. So I think that the development of a strategic plan is something that is going to make it so that in the future it's not just this continuous emergency response to a situation, but a more well thought out plan of how to approach the situation.
A quick follow-up. You said April of 2026?
26.
Yes.
26.
Yes, sir.
So that means there's folks like you in all 14 counties across the state?
We're the only two.
Only two in Rutland?
Yeah.
Because we've been hit so hard in welcoming.
And because the mayor's on the League of Cities,
Why so long though? Why? Are we going to keep funding at this level?
Unknown whether they're going to keep funding at this level. There are different individuals. Go ahead, sir.
Thank you.
The thing that concerns me is just exactly what he just said. How long will this go on? and we look at this thing from what you just told us, that this has gone through this winter. It's going to go through this winter. But there's no plan there. So if we're going to do transitional housing, that means it's got to be at least 2 years before anything would even be done by the time you're done permitting and all that type of thing. That is that's disturbing. But that isn't the whole problem that we have. You have to look beyond that. And one of them is, this one drives me absolutely nuts. There's a little boy, he's big. I've seen him twice. He's at Irving Oil Company and at Stewart's. He's in there having a supper, which is a hot dog, a bag of Doritos, and a 2-liter bottle of Mountain Dew, which is cyanide. And this is, what is the chances of this young man becoming a type 2 diabetic if he's not already, and his mother's a very large person? Then you go up the street, and it looks some days like it's a zombie apocalypse up there. So you go through there and you're going, oh my God, I feel sorry for these people, but nobody is asked to clean up their act. So consequently, when you're coming down off the mountain and you go by these tenant houses, would be nice because tenant houses at least have a kitchen, but these don't even have that. And you go by these places where there's drug infested, little boys going to be diabetics, no kitchen, so every one of those people is eating crap, which means eventually they're in the hospital with diabetes. This is so far outrageous. It's outrageous.
Yeah, and I think this is probably a good time, if there's no more state questions, to talk more specifically about some of the stuff we've been working on that go beyond the Emergency Housing Task Force program. Are there other statewide questions? Okay. Oh, yep.
Okay, I just make a comment. So a little while ago, Brave Little Satan, Vermont Public did an investigative piece where they were looking at where the homeless folks in Vermont came from and whether we are a magnet for out-of-state folks taking advantage of our services. And in 2 separate data sets, there wasn't an in-depth study that they could find, but 2 different data sets that they came across basically said it was about 4% of that population. So the anecdotes of them all coming from out of state seem to be overblown. They talk to professionals in this field from around the country, and that is a very common concern. Anywhere where you've got a high population of homelessness, people are like, they're coming from out of state. So people in California think they come from Oregon. People in Oregon think they come from California. And then they went further and they talked to some researchers who tried to see if there really is a magnet effect at the state level from being overly generous, and they couldn't find a correlation to that. They looked at some of the bigger population centers, so it may not apply to Vermont, but it was a good piece and it added some really good context for this. So I'd encourage people to go find that story that they did and take a look.
Let me tee up Megan with that one. Megan is a school-trained qualitative researcher. I would like to know, not the national data, but the state data. Did that say who was collecting the raw data on that?
Yes, one of them I think was at a point in time count I think that you've referenced, and then there was
Now, point in time has nothing to do, and I'm sorry to interrupt.
Okay.
But point in time does not have any data associated with it where people came from.
Okay.
None.
But what I will say is that we have heard other stories today in the General Assistance Emergency Housing Task Force. Brenda Siegel, the principal at End Homelessness Vermont, has been collecting some data on her own about people receiving the general assistance funding, and presented some data on that today. We haven't had a chance to look at any of it ourselves, but what she reported out was similar to what you're saying, is that some of these stories from people coming out of state may be anecdotal, because out of the one data set that she had, 200 people that they surveyed who were staying in hotels and motels around the state of Vermont, 8 of the 200 were from out of the state of Vermont prior there, at least. And I'm not sure how she based that off. I don't know if that was their last living situation or just a self-report. But we are hearing, there's conflicting information about if these people are coming from inside the state, out of the state. And the reality is we're working with several unknowns here. This program is going to end. We don't know how it's going to impact the number of people that we have here to serve. But we basically just have to go off the notion that there's going to be a large amount of people, more people than we're prepared to serve. And so that's kind of the angle that we've been operating from. And not so much trying to determine where these people are coming from, but trying to figure out, keep ourselves focused a little bit on what we're going to do
Right.
about it.
And if I can offer up also, there are other individuals who also assert that not only did they not come from out of state, I heard again today, individuals assert that the homeless population in Rutland is all Rutland. And I'll just leave it at that. Because I don't think we would go in the Rutland County from an average for the last 10 years of 100 people plus or minus 5 to 684 with this motel program in place, and state employees and providers alike, including Brenda Siegel, asserting that they funnel individuals to where the hotel rooms are, and Rutland has the hotel rooms. So let's not conflate coming from out of state with coming to Vermont from even within state. So
Yeah.
that's
Yeah.
your call now.
All right, so yeah, a little bit, well, if there's no more statewide stuff, and it's not to say at the end if a statewide question pops to your mind, you can't ask that, but I do want to give you guys some information about what we've been doing since August, which is when we really started hitting the ground running on our work as the homeless response coordinators for the city of Rutland. And what we've had to do to kind of keep ourselves focused on this issue, and the idea of creating a plan for Rutland to be able to implement in the future, so that if there are these outside statewide policies that might be impacting the community, we're better prepared and our systems are better prepared to handle that. So we have created some guiding questions that are focusing our outreach at this point in time. Some of those questions are, what services are currently available in the city of Rutland and to whom, what are the eligibility requirements for those services? What are the barriers to those services, and cataloging some of that. And we're being creative with the services that we're looking into as well. We're not just looking at services for substance use disorder and mental health services. We're also looking at services that can help individuals who may have been moved from a different part of the state of Vermont to Rutland because there was a hotel room, but maybe they want to get back to where they are because they have better job opportunities where they came from originally, or they have social connections where they came from originally. So we're looking at all different types of resources that could respond to this issue. The other components that we have to our work are looking at how we can get the Loretto home transitional housing off the ground. But we realize, that's not going to solve every single issue. At the moment, that facility is going to be housing a small number of units compared to the amount of people that are in Rutland that are facing homelessness once the 80 days are up. So within that aspect, that component of the strategic plan, that's, it may come to light that is not a viable option for the community in Rutland. And so that's why we have these other things that we're looking into. Another approach that we're taking to this issue within the plan and investigating is just the housing market in Rutland, figuring out where it's clogged and how to unclog that. There's some people that may be living in low affordable housing and have been there for 17 years as a rental tenant, and we're investigating ways in which the city or maybe even the state could support those individuals in purchasing a home so that it becomes more available more units available within the city of Rutland. And then we're also looking at how we can facilitate resource acquisition and access to appropriate resources. So in some of the early conversations we've had with the providers in Rutland, we're finding out that, especially the providers who have a facility in which people are able to live there while they're receiving services, we've heard that maybe some of the people in those facilities might be better served at a long-term care facility, but they're having trouble finding a long-term care facility that has available beds for them. So, we're looking at this issue in Rutland at this moment. Like I said, we've only been working on this since August, so this is the raw, rough draft of our strategic plan that's going to be changing many times throughout this process. The angles we're taking are trying to figure out the resources that can help individuals who want to leave Rutland get back to places where they have more opportunities, more access to resources, more social connections. We're looking at the viability of the Loretto Transitional Housing Program. We're looking at different ways to unclog the Rutland housing market, and this also looks at policy as well, looking at, are there any policies that are making it harder for landlords to rent or making it harder for people to rent from landlords, and trying to see if there's any policy recommendations that could be made. And then the final thing we're doing is looking at making sure people are accessing appropriate resources and figuring out ways we can help them access those resources. It's a little bit, in some ways, the last two parts of that are trying to move some things around to make sure that we can free up more resources for some people and maybe help other people get to the resources that they're actually looking for. So, I mean, it's like I said, this is it's going to change our strategic plan, but I wanted to fill everyone in on what we're doing because I want you to know it's not one-dimensional, that we're coming at this issue from several different angles. And I would be happy, if you guys have listened to this and said, well, what about this? We want to know that, because I want to come at it from every single angle possible. One of the guiding questions we have is, what are the community perspectives on the issues of housing and homelessness? Because we know that the experiences that you guys have had living in Rutland with these issues are going to be extremely important to inform other avenues that we might want to investigate. And so, anything to add, Chris?
No, I just want to go back, wrapped into that with the clog that Megan's talking about of getting individuals out of the way the landscape is right now, from the hotel to a transitional housing facility with wraparound services, support services, to an independent, low income, mid income, marketplace space where they have no supported services, but then also a permanent place where there are supportive services. So there's this train of moving from one housing situation to another, and it's clogged, as Megan said, along the way. We heard stories from Rutland Mental Health that they have a facility. There are people ready to leave a transitional supported facility into their own apartment, but can't find that own apartment. And if they did, someone else would be able to go into that space in that transitional supported facility. With those facilities, as you said, they've got kitchens, and right now that's the challenge with the state continuing to shore up the hotel motel program, is every dollar that is spent on the hotels and motels, and that's private sector, and that goes into the pocket of those motel and hotel owners, is one fewer dollar that can be used for permanent housing. So the people who are in the state who are really hyper focused on getting permanent affordable housing built, that's a frustration for them, that they've seen 4 years of hundreds of millions of dollars going to motels and hotels, and sometimes those are really, I'm trying to be diplomatic because I said something today earlier at a meeting that I got called out for that wasn't diplomatic. I'll just say it outright. Thursday, I also walked through the former Holiday Inn where Billy used to cook. It is, I had to suppress my gag reflex 4 times walking through there. And I think homeless advocates, and I'm going to say this outright, anyone should be ashamed of themselves who has a hand in putting people in the Cortina Inn. I'll just say it outright. After what I walked through, it's just plain wrong that what people are living in that. And I'm just only talking the common areas. There is nothing being done in any of the hallways. and it is a worse than unfortunate condition. Go ahead.
So I don't live in Rutland City, I work here.
Yep.
So I assume that also that location you speak of has the majority of rooms that are available in Rutland. And at one location.
At one location, probably only because of the size.
Right.
The other one's like the roadway in, the roadway in.
So
the next
what is
door,
the
so-
likelihood? They're on a downhill slope. I mean, things are just getting worse and worse there. How much longer are people even going to be able to live in that building?
There's a great article in the Herald today about the Vermont Department of Health rolled in on them. They've got a deadline of when they're supposed to remedy all the problems. And Miranda Gray, the DCF Heart Children Families deputy, is going to be going to Cortina tomorrow. And when I talked to her today, she was wearing open-toed sandals, and I said,
Yeah.
wrong footwear for that place.
No,
So
I've
she
been
is-
there providing vaccinations and health screenings to that population in that location. But not probably in the last 7 months. And it wasn't very good when we were there. And you have to understand there's now babies being born in this housing.
Yes.
There are infants living in these conditions, not
Yes.
just toddlers or school-aged children, elderly that are close to just being basically immobile. So a lot of what you speak of are very reasonable alternatives and things to pursue. But again, I think the real concern is now. What is going to be done now? And a lot of, perhaps because I'm in a health environment, I hear a lot about health and safety. Is there anything in this interim, okay, it is what it is, nothing's going to change overnight, especially this situation. Can we implement some things that will at least improve the health of the individuals living in these places, as well as, therefore, then the public in a public health perspective? Can they get routine health screenings? Can they be required to be vaccinated with the flu shot, pneumonia? Can we make sure that all of those that are 75 and older, as the CDC requires, obtain their RSV vaccination? And that those that are 65 or 60 and older with high risk, which I would say all of those living in these places are, also get their RSV vaccination. Pneumonia. Now, if they don't have Medicare Part D, they will never afford to be vaccinated for RSV, right? Or shingles, because Medicare A and B does not cover those vaccinations. And boy, if you're looking at a population that should have that protection, so what's preventing things that we can do now? Is someone really, is there a group that's sitting down and saying, okay, here's the long-term thinkers, here's the strategic planners, very, very important. But what can we do now? Any little thing that is positive.
You've got my mind, and I'm sure Megan's mind thinking right now, but that's a perspective I can tell you I haven't heard yet, is that pure public health perspective.
And it is.
It's right now it's
You're going to the
tangential.
Same gas stations, same supermarkets, possibly the same restaurants. You're encountering them everywhere. And, it is a public health issue.
What I can say from the perspective of the conditions of the buildings, I know that Rutland's building inspector has been doing more and more checks on those hotels and making sure that the rooms there are up to the codes, at least the way that the codes are written. So I know that there's been more oversight there on the city of Rutland's part. To the public health issue, that's not something that's particularly within our purview. I don't know if you have anything you might want to add from that perspective. representative.
The city does have a public health officer, or a health officer. And again, I'm not entirely familiar with what his responsibilities are, but my understanding is that the state has also somewhat limited the local health officer's authority. And that's been kind of a real challenge for the city. And that's, many of the issues that we typically get calls for to certain locations that aren't police matters. Now, when possible, we respond with a community resource specialist, which is a non-sworn member of the department. Really represents the city, but works out of the police department. And so, when we respond to certain locations, if there is criminal activity, it's referred to a police officer. But when it's not, if the conditions exist at this particular location that do present a health issue, then we do refer it to the health officer. But as I said, it's the authority's been somewhat limited by the state. It is frustrating, and so.
But
And I see that happening in the environment in which they're living.
That's the environment.
Those housing and living conditions. I'm talking about the individuals.
yes.
So, Project Vision, as you know, Matt Prouty, Commander Prouty, the Free Clinic, Rutland Mental Health, and Turning Point, and the Vermont State Medical Reserve Corps, we have an interagency team that goes out every other Monday to Companions in Homeless for a couple of hours, and every Wednesday does street outreach. And Dave Carlson, if you don't mind, Dave, I'm going to put you out there, is the field assistant, and he is the one constant, really, that is always there whenever the team goes out. So, and Dave, feel free to add to this, but so we're just coming up on a 1-year anniversary of implementing this program. And I think it probably took a good 4 months to even get individuals to start engaging, because they were consistent. They were going to go every time, even if nobody talked to them. They're going to see them every time and know they're going to show up and they're going to be there. And they can get assistance. They can get wraparound services, right? But then we have individuals that should be getting wound care for xylazine wounds or whatever, but they don't really want to do it because they're afraid that might lead to, I don't know, maybe some conversation about, substance use disorder treatment or something of that nature. But what if they had to do it? What if they had to get that wound treated because they can't continue to walk around the streets and go in places with an untreated wound that's going to be infected, and not to mention what it's doing to themselves. And as far as the state level, also with the dental vouchers, that's a GA problem, huge problem. Our dental requests could far exceed our medical requests for care. Dental is huge. And you have to think about that. They keep getting reoccurring infections in their mouth that go into their bloodstream, and they're going to end up with a serious health condition that's going to be much more expensive to take care of, and how many other people is it going to impact? But these people can't get a dental voucher through the state. They either have to, and I myself have been waited on the phone for general assistance for over 3 hours and 40 minutes one day before I could speak to somebody. So they can get a voucher to pay for that extraction if they either go to the second floor of the Asa Bloomer building and sit there and wait, which some people have waited up to 3 hours, or they can get on their phone and they can wait 3 to 4 hours on their phone, because they need to verify that the person that we assisted in completing the voucher application and the free clinic faxed it to the state from our fax, they still want to speak to the applicant to confirm that that person submitted an application. So I wrote to them, I said, look, these people see a medical provider, they're given an antibiotic if they have an infection. We have dentists that we can send them to get their tooth extracted, typically within a matter of days. But you're not going to give them, you're not going to trust us to verify that this is a real person and we're representing them and confirm that voucher. So you wouldn't believe the number of people that do not get assistance. So they end up using money to get the tooth pulled that would feed their kids or put gas in their car to get to work, or have to because they just can't deal with the reoccurring pain. And they can't leave their job or be on the phone for 3 hours while they're working. That boss has no problem with that, right? Whereas an elderly person that's had a stroke has to go find parking in downtown Rutland and go up 2 floors in Asa Bloomer and sit there and wait. And many of these people have, it's not easy for them to accept help, especially our older Vermonters. They're proud, but they realize that this is something they have to do. But then when you tell them, okay, you're going to have to drive downtown, go up 2 floors, go to, well, isn't that the welfare office? Yes, it is. And I'll have to sit there and wait to speak with someone? No. But the state, the response, I sent a very detailed letter to the state, and I was informed that they were not prepared to make any changes to the program at this time. 1 sentence. Not thank you, not nothing. That was all of my response, 1 sentence. We can do better than this. We have to do better than this. So I'm going around trying to raise money so I can help those people that can't afford to pay the $200 or $300 to get their tooth pulled, right? What can you afford? Well, I guess I could do $25.
So I think one thing you're pointing out, and that's why you got my attention, I responded with that public health piece, because I think when I had the same idea, when I said public health, well, I think I knew what you were talking about, and you knew what I was talking about. But because Vermont is a shelter first, which is different, I was schooled on this one, different than housing first state, we're a shelter first state. That means you get a roof over somebody's head, hotel voucher, and then deal with those issues then, to the point where there will not be any mandated interaction, and there is no mandated interaction with substance use clinicians for those who are suffering. There is no requirement that individuals who may have a mental health condition engage with mental health, because we need to get them into shelter first. You bring up a whole other perspective as far as that individual's physical health beyond substance use and beyond mental health, because those are the 2 co-occurring disorders we always go to. And I know you get that too. I get you get that too. But when you're talking about seniors and flu shots, vaccinations, that type of thing, that seems like the first thing I've heard that's a low-hanging fruit, but still, how we get individuals forced upon them is another question. Before I take you, Senator, Chief, Matt Crowley talked to Megan and I about getting a van. I'm sure Matt Prouty talked to you. So the city, through the Vision Center, through the PD, is working to try to get you that van that then Matt and his community response team with you guys will be able to get out in the community. And that's an immediate type thing, but it's not a solution. Senator.
So I'm going to ask some questions that people would think I would know, but I really am asking them because I don't. So in a former life, we have a saying that safety is everybody's business. But if safety is everybody's business and nobody is specifically looking at it, we have a lot of safety problems. All right, housing, let's go back to housing. I've been going to housing meetings in Rutland for the last year and a half. And we've got the continuum of care, homeless prevention center, we've got ad hoc working group in the regional planning commission, we've got a Rutland city group. Who has the lead on housing? Because we've got all these other problems. I'm on the health and welfare committee, and I talked to my chairwoman and Keisha Ram Hinsdale, who is the housing and economic development chair up there. They said, gee, we hear you're going to all these meetings. Who's got the lead? And I said, what do you mean? I said, who has the lead on housing problem in Rutland? I said, I can't tell you, because there's 15 different groups working in 15 different directions. What we need is one person to be the point person, or person or group, because you've got the Project Vision, which is a great organization, and everybody there is concerned, but we need one person to go to start with a vision how Rutland, it's not just Rutland City, it's Rutland County. How are we going to fix this, and who's responsible for it? Okay? I mean, we've spent enough money on housing these people in the last 2 years. We could have built a transitional housing facility, maybe just a temporary thing, based on what we've given away, and we just keep it gets worse and worse and worse. And I'm a senator, so I should know the answers to all this, but I don't. All I see is the problem. So we need a vision for fixing Rutland's problem, somebody to be responsible for it, and then a strategic plan to get there.
Yeah.
So who has the point?
Nobody at this point. I think
Okay.
that's part of our work, is identifying all the people in Rutland, all the various meetings. You know, we've talked about this several times
Okay.
in different contexts too, about how many meetings are happening each week around issues that are related, and there's so many
Right.
different groups working on all of these issues.
Right, and the majority of these groups are nonprofit, all right? So there's money being donated, there's money from the state that's going to those, and we keep throwing money at it, but we don't ever fix the problem.
Yeah.
Yeah.
So part of, identifying who the people are in Rutland that are working on this, either as their main focus of their organization or just tangentially related to it, is going to be identifying the people, and then potentially creating, we've talked about this, and we'll call it like a smaller, more focused Project Vision type model, where you get those people all in the same room talking about the same things and sharing information and seeing what can come of that, and at the same time collapsing all of those different meetings that are happening throughout the weeks and months into one, so
So
that
can
it's
we all
more,
agree that we need to have somebody at the tip of the spear that's going to be taking the ball and coordinating all these organizations?
I would say that we can agree that that's the aspiration, getting through the practicality of the silos that are among those individuals. And you ask why it hasn't happened, my guess would be not for necessarily lack of will, but taking as a lesson from what we did around the opioid crisis 10 years ago was that individuals had to recognize there could not be fighting over all the same nickels in the street. Sorry, Chief, that's a Jim Bakerism. And that's what was happening. And the goal is to get everyone working together, and not just for their own organization's benefit.
Okay,
And that there is no tip of the spear.
so we need to make one.
Make a tip of the spear.
I go to the continuum of care meetings with the Homeless Prevention Center. Angus Cheney does a great job. The people that come there are all engaged, and they all continue to provide support where they can, and they just ask the question, why are all these people coming here? They're coming here because you people are taking care of them, and because we have the facility and the desire to do it. We need a place where they can come, and we can house them, and then we can get them in one place, and then we can provide all the health support services that they need. And the state needs to get involved in it somehow. They can't keep pushing it off to the nonprofits, all right? My problem, because I'm a legislator, I'll bring that back to Montpelier if I get back there. But in the meantime, we can do a lot to fix the problem right here.
Yes, thank you. I appreciate
A
that.
really important point on Shelter First.
Go ahead.
Shelter First primarily refers to the obligation of economic services to refer people to a competent shelter program, which does include programs with wraparound services, behavior-based requirements, engagement requirements. But when we had 1,100 homeless people in the state of Vermont, we had 550 beds. Now we have 3,500 homeless people in Vermont, we have 550 beds. We didn't have enough when we had the much smaller group, and so there was never enough space with appropriate services to refer people to.
That's right.
And that then brings in the motel system as the hand grenade in an apple basket. I mean, it's just sort of, let's just throw that, see if that works.
Yeah, and that's definitely one of the barriers that's already on our radar, and something that in my past work with Crime Research Group that I was made aware of about, the status of social service agencies in Vermont and the issues that they've been facing. Quite frankly, since the coronavirus pandemic, there was a large shift out of people serving in social service positions. They, got compassion fatigue or couldn't, really didn't want to be doing that kind of work during the coronavirus and found other jobs. So there's been a declining number of licensed clinical social workers licenses issued and renewed by OPR over the last couple of years since the coronavirus pandemic. So a large, one of the barriers that we're definitely is on our radar and investigating is, issues, whether it's policy that could maybe impact those organizations' ability to hire, to make those hires, to fill the positions for the people that can provide those direct services. One of the things, the last time I checked, and I haven't, this is something that just got brought up in a recent meeting, that we may investigate and make recommendations in our role as the League's representative to the Emergency Housing Task Force, is that for this issue of where there's not enough people serving in those roles, the state of Vermont doesn't currently have reciprocity for licenses issued in other states, and so the providers have cited that as a challenge for hiring, that someone can't just come in here with a license, certain licenses from a different state, and start working in the state of Vermont. They have to go through this entire process again, and it's been, so there's, certain policy barriers that are related to that, moves could be made on that might help get capacity up for the agencies that need to be able to work with this population as well. Yes.
From what Senator Williams said, are you guys going to these other housing groups meetings, and are they coming to yours? I don't know if any of them are here, but are we working together? Because I'm telling you, April of 2026 is too long to wait. From what the senator just said.
Oh, definitely. We've already been to several meetings. This Friday, we're going to the Rutland Continuum of Care meeting, and so that's part of our job, is corralling everyone who's talking about this, whether it's individually at first and then all together later, and learning what they know.
And what you just said about the licensing from other states, Kristi Noem, governor of South Carolina, did that. They dropped that, and they had an explosion of providers. So maybe a model to look at.
Okay, I will. Yeah, I'm from South Carolina.
No, that's
South Dakota.
I know they've done it for situational care. Bennington recently had a remote area medical event, grand event. They come out of Tennessee and they come up for a weekend, and they provide free vision exams and dentists and dental care, and they'll see hundreds of patients in just a few days. And OPR did agree this last time to waive that, so some of those providers could come through and work that event for the weekend. So that was something, because I don't think they have been very receptive to that in the past. So maybe things are moving.
Just one more thing about the tip of the spear. What we've got here is a circle, and the only thing that's happening is the circle's getting bigger. We have to decide, where do we cut that circle, and we straighten it out, and we cut it where the most good can be done. So that's the lead. It needs to be, if it's a housing problem, that we gotta fix first and we can fix all this other stuff after, then we need to do that. But we need to appoint somebody, if the state's not gonna do it, then somebody at the local level should.
Yes, sir.
Hi, I'm Dave. I work with Matt Prouty and his outreach care team. Prior to that, I was a recovery coach at Turning Point and I probably spent more time in the Cortina and the hallways of the Quality Inn than anybody in this room. With our street outreach, I just have to say that, this seems to be a room full of people who are rational thinking and experience linear progressions in their problem solving and things, but the individuals that I work with twice a week and have for the last year do not necessarily, they create their own barriers. It's extremely difficult. One of Matt's premises is that there's a very small core number of very high need people who are probably using a disproportionate amount of services. And if we can reach out and target them and give them a lot of support, you can't ever predict or chart the numbers of all the problems that didn't happen because of interventions you made, but you can kind of get a good idea. We had one gentleman living under the bridge, and it took months of hand-holding to get him to come out from under the bridge and finally get into services. So all of the, it's wonderful to sit and talk about policy and creating the magic thing that's going to, I sit in meetings and I listen to people going on and on about, isn't it wonderful that we're having the discussion to create the conversation to develop a policy that's going to solve the problem. And it makes me crazy because I'm the one who was like, stepping over the same dead pickle on the rug in the Quality Inn. I remember when the Quality was worse than the Cortina. It's picked up a little bit, but you walk through there and you see the broken doors and the smashed locks. I take meals, frozen meals from the farmer's market on West Street there. 2 weeks ago, I opened up the freezer door. It was as hot as an oven, and all my little frozen meals were percolating and melting and dripping in the oven. It's difficult. Our group was one of the impetuses in the beginning was about xylazine and xylazine sores, and we haven't. It is so incredibly hard to get someone who is covered in xylazine sores to actually develop the trust to admit to you that they're an IV drug user. Sometimes it doesn't happen at all. At Turning Point, I ran a lot of groups in Marble Valley in the jail, so I knew a lot of people from that, and that's been an override. Of our successes, the guy under the bridge, who was extremely difficult and unpleasant to deal with, finally is out from under the bridge and now trying to navigate homeless prevention and all these things and not doing very well about it at all. There was a mother-son, both IV users. I had actually worked with the son in jail. He had an arm that was like a Popeye arm at the church, and he was like, "Look at this," and he poked his arm and pus was squirting out, and he wouldn't go to the hospital. He had been to the ED the day before and actually left because he had waited too long and he needed to go out and use again. Finally convinced him to get to the emergency room. They turned out to be a success story. I see them almost every week, and Mom just gleefully showed me her latest negative test result from her MAT provider. So she passed the whiz quiz. It's wonderful to see that, but there's so many, and the thing we have 2 case managers that go out with us, and while we thought when we started this thing with a xylazine model of it was actually the top help and the support of the 2 case managers and doing everything we can to support. It's Angela French and Bailey Wright. They're with Community Care. The medical first aid component of this, which we were all ramped up for, became probably the smallest thing. some of the biggest things are actually, handing out Band-Aids, but hygiene kits. Toothpaste, toothbrushes, soap, shampoo. We help people with giving them an opportunity to do their laundry and take a shower. All of those things, all those the little help. And yes, there are people I think I know you're from Pennsylvania and you're here every week and nobody could possibly use that much shampoo. Here we are. I just struggle sometimes with the fact that I think I would say 2 or 3 out of 10 people actually are engaging in a meaningful way. 4 or 5 other people are getting enough support that it's helping them, and a lot of people are like, they'll take what they need, but they will push you away.
But next week they might not.
They might, yes.
And that's the way this work has to happen. And that's doing something now. That's something we can do now. And so this morning I bought your hungry fund to go in the hygiene kits because they're headed back out to the techs. We need bug spray.
The other thing is, I think because I'm in my 60s and overweight and have gray hair, so everyone assumes I'm a cop. So it's very with that. But in terms of the community, I know I have personally probably picked up somewhere between 400 and 500 syringes in the last year. On our record day, we picked up 157 syringes along the railroad tracks. Pretty crazy. So even, and there are people who don't like what we do because we're enabling, or in their perspective, we're enabling. But it's, I don't know, it's getting.
But this is the ground level field work that you've got to. Again, making a strategic plan is very important, but you've got to start at that ground level. You've got to establish the relationships, establish the presence. And I think it's no different when, way back when the city police started the walking beat in the northwest section again, and pushing, the surveys were done, the community impact study, and you have to start somewhere, and that's never a bad place to start. And it's something that at least when people say, yeah, you're talking 2-3 years out, what can we do now? At least there is something that we can do now.
Well, when Megan mentioned, as I do as well, when we say our sole deliverable under the contract is a strategic plan in 2026, implied there is other things have to happen before that, and that's where the cataloging the partners, and there are a lot of them we haven't made to you yet. We haven't made it to the parent-child center yet, haven't made it to Turning Point yet, because the amount of groundwork we've been doing over the past several weeks leads us to other places like the state of Vermont and doing policy statute research. And yeah, it stinks that it's delayed us getting to the folks around the ground, but that's becoming more critical now as the 80-day program is running out, and as I said, especially for the kids and the kids in the schools.
Well, and that's not to say that we have started reaching out. We've talked to several different service providers, and that is definitely part of creating the strategic plan. It's not just about going to them and saying, what can you offer us? It's about what can you teach us from what you know? Because really the service providers, the people providing those direct services to this population, they're the experts on this issue, and we want to learn as much as we can from them to create a strategic plan that's going to be impactful. And so, as we talk to more service providers, our list grows. One of the questions we ask is, who else should we talk to? And so we're learning about all of the different service providers that are working in the Rutland area, and thank you so much for the work that you're doing right now, because that is something that's not the focus of the strategic planning process at the moment, but it is something that these things need to continue happening, and hearing your perspective can inform, the investigations that we take, the routes that we take, the recommendations that we end up making for what needs to be supported, what maybe needs to change policy-wise going in the future as well. So we'll definitely talk to you after this, get your contact information so that we can connect with you guys sooner rather than later.
Go ahead.
Yeah, so I'm guessing the strategic plan is going to be a mix of sort of short-term and longer-term things. You talked about trying to unclog the housing pipeline, and I think that's a longer-term thing. Right now, the Rutland City Planning Commission is rewriting the zoning bylaws, and they're trying to balance smart development with not getting in the way of more housing. But if there's stuff that you're finding either in our current policy or just broader policy best practices to kind of encourage housing, it might be worth going to one of their planning commission meetings or talking with Andrew Stranisti, the zoning administrator, and make sure that they've got some any information that you've got to help get us going in the right direction that way too.
Oh, definitely. We will be in contact with the Planning Commission. We have had a conversation already with Devin Neary and Logan Solomon at the Rutland Regional Planning Commission, who are also investigating some similar things for the upcoming plan related to housing. And so we're, the same way we're learning from service providers, we're going to be going to all of the points that I mentioned earlier. We're going to be going to the experts on those points, hearing from them, learning what they know, and then bringing all that information together the best way we can.
When you're continuing care, you have health care at the table. Are expletives, are they part of the
Senator, did you hear the question?
No.
Because we have not been to our first continuum of care local. We've been to the base of state just this morning, state balance of state.
Because I know VNA's in hotels. They get a referral to some
Yep.
individual in some emergency room. So that a referral is not always, but depending on the need, you said whether it's therapy or nursing there in these hotels. So my question was, is healthcare part of the continuum of care? Is Rutland Regional Medical Center, the free clinic, VNA's, Vieta, are they at the table? Because they're in the field, they're seeing these people when the need is great. They should be there to help problems.
I think they are. Yeah.
And if
we deal with have actually been trespassed from the hospital.
Yes.
Can't go there. Absolute emergency and then out the door. So a lot of people have created their own barriers to receiving help.
There is another group that's working, about the Methodist Church, feeding those folks up there.
companions and homes.
75,000 last year. Yes. Well, they're looking for a new site, church, the Catholic Church owns, it's empty. They're talking about putting a full kitchen in there. They can sit 200 people in there. They also put showers and restrooms downstairs. They're also going to do wraparound services in the small room in the back. That's a location where you can end up there while they're eating, so you can bring their services in. I think that should be a full court press there. That's not a hard deal. That thing is already sitting there. I think we need to support them to move that to that location.
Yes, Ellie McGrary is on our list of people to speak with. I have been to the Methodist church during the breakfast serving hours before too, and as we, they've already been in conversations, or they've already been mentioned in conversations between us about a potential partnership for the transitional housing program, because we would be bringing in, a variety of different services into that model. But I'm sure once we talk to her, we'll learn about plans that they have too, and we can see how we could coordinate and work together towards similar goals rather than working parallel. Sir?
They can operate 5 days a week and provide meals for the weekends. I think it's an opportunity we should look at. I know it's not a long deal yet.
No, it's good.
I think it's something we look at. It's increase the possibility and serve the community. Sorry, the tax rules is not going to have to small where they're at. They need to get a bigger space. And then the service organization should be assisting her in buying all the supplies she needs, like the Rotary and the Lions and all those groups.
Yeah.
They should be filtering stuff. I know the Knights of Columbus does something.
Yeah, we've spoken at the Rotary in the early beginning of the program.
We do stuff with the Knights of Columbus in Rutland that Bill and I are both a member, and Senator Williams is a knight as well. That we do care packets that we pass out.
Yeah, but we're trying to find them. They know where they are.
That's what I'm saying.
We should be handing it to them.
I was going to talk to you after about getting to dovetail with that. But also for women's services, you've got First Step Pregnancy, and the new executive director there is trying to do that type of outreach. So.
Yeah. And this is what's good about getting people who are doing things in this field together, because they can learn also about the other services that people are providing and learn about how coordination can happen between them. Yeah.
Just to kind of piggyback off of what Mr. Barron said as well for women's health services. Planned Parenthood of New England has a Rutland location that is incredibly active. They have an amazing staff. They're wonderful people, and they're very participatory in on-the-ground grassroots efforts in the community. They'd be another great resource to reach out to.
Thank you.
Okay, for the folks who have a public health perspective, I'm going to ask a same question that the senator asked us about tip of the spear. Is there any one person or organization, and I would hope it's the state of Vermont Department of Health nurse who's at Asa Bloomer, is there any one person that you know of who is coordinating the medical efforts for this community in the Rutland area? Do you know is there anyone riding herd over you guys? And that's just an ask, or
I work with the lead in the immunization department of our local district office in VDH. And we collaborate, we build clinics all throughout the county. We do them together because the state can vaccinate 19 through 64, but we vaccinate the 65 and over because they cannot. So they cannot do health screenings, but we can do health screenings. So we have partnered a lot, and we have a very close relationship. And then the free clinics started using the state medical reserve corps to supplement our clinical volunteers when there weren't enough. And so now they are also a part of our health effort collaboration. So I would say if you were interested, we could arrange a meeting for representative of the free clinic, the VDH Public Health Office, and the probably the Addison Rutland District State Medical Reserve Corps, and bring those three entities together and meet with you.
Thank you.
What you need to do is get everybody in the boat rowing the same way. What's your plan? I think that's the bottom line.
Yeah, and with the recognition, get everybody in the boat rolling the same way.
Yes.
And that had been our goal from the beginning. But, I don't know if we still have a half an hour, so we can keep going. But this is not to wrap up. This is not me saying, I've recognized a couple of themes tonight, but I want to say it now so we have time to talk about over the next half hour. If I am missing something, if Megan can offer something also that beyond what I'm about to say. I've seen two themes tonight. One is around, a lot of public health conversations, and the other is that whether we're talking tip of the spear, the kid eating the hot dog with the Doritos, there's a recognition, and I think there needs to be an acceptance that while the state can provide resources, we as a community are essentially on our own. And there's going to be a press conference tomorrow by the League of Cities and Towns that's going to articulate that as well, is that the municipalities who are least equipped to deal with social services are the ones who are being put in the position to put all these resources together, to put the housing together, to put the public health together, to support the work of the folks, possibly moving to IHM. And anyone else who either has already spoken or hasn't spoken yet, throw things out there. What are there any other issues that we can discuss, or do we want to put more meat on the bones around trying to create a local response versus waiting for the state to show up, which
I
they
think
won't.
somebody needs to be, somebody from the administration and from the legislature needs to be involved, so we have some continuity of effort.
Well, I can tell Adam Sansick is,
Yep.
he is in the middle of it.
Yep.
In a very positive way. So that's the administration, if you will, AHS. And as far as the legislature, that's up to y'all, how you want to manage that and, be involved. I think one thing that would help Megan and I would be to sit down with the delegation, whoever from the delegation can show, to have conversations, and you give us your subject matter expertise from the legislative perspective. We need to know that as well. What challenges you're seeing. Hey man, I spent 2 years up there and never wanted to go back ever again. Because part of it's this very reason. It's to work in the legislature is a long, slow train, and you've got to pull. If you don't pull a lot of resources along with you to educate yourself and to create a response, you're going to have a very defined and focused group of individuals who are going to define what you should do, in their opinion, without giving consideration to the rest of the community.
So they pass the legislation and they allocate the funding to affect what you need affected. And when they asked me, who's got the lead down there? And I said, I don't know. Why don't you know? Because they don't provide oversight on funding that comes out of the legislature. And I just use that as a broad brush. I'm not pointing to anybody.
No, I get you.
So we need some continuity between somebody maybe in the Housing and Economic Development Committee. Probably at least I talk to the chairman of the House and the Senate committees to see if we can get somebody to be involved in that. I mean, they have working committees all summer long, and we don't want to kick the can down the road anymore. I mean, we've had this problem for 3 years.
Yeah, I think the approach Chris and I have taken has been a little bit more from the community level up at this point, because once you get up there, it really slows things down. When it comes to discussing things in committees, and then there's a committee about the committee, and and so you run into those issues too. So we're really what we're doing right now, since August, so it's only a month. We still have till April of 2026 to come up with a strategic plan for Rutland. We'd make our way up there, I think, eventually, if there were things that we found along the way that we need the state's help from. Our particular perspective and goal right now is to figure out what we can do as a city.
I hope I got the message out the way I wanted it to come. I'm the world's worst speaker. But I just wanted, my concern, of course, as I mentioned with the LaVoy and stuff like that, is the condition of people up there, and that bothers me every time I drive by there. But the second thing here is, this is something that we haven't put our finger on yet, and that is what this is doing to the economy of Rutland. Now, I orchestrate a couple things I've done in a couple major events over the last couple of years. Try to get a motel in Rutland. I just looked on here. You know what it costs to stay at the Hampton Inn? It's $226 a night. I can stay in York for that. And I had people, coming in. I put on a pickleball tournament. Well, anyway, I had people coming in, and they finally found a couple places. One of them went to one of the motels, which I wish they had got in touch with me first, because they were from Drake, Massachusetts. And that was the message they got about Rutland, and that makes me ill. So, I think when you are approaching this type of thing, yes, the first concern is the health and the wellness of the people involved. It makes me sick. But the other part of it is it's number one, it's mushrooming, and it's going to mushroom. And number two is it's having a great effect on our community that people haven't felt yet. And I can feel that already.
Yeah, and that is something that's, when we're considering the housing market in Rutland and the ways in which it's clogged, the hotel voucher program has had an impact in that it's taking up the rooms of places where typically people would come and stay, which has caused people who may typically be renting their apartments as long-term rentals to switch to an Airbnb model. And so it just becomes this chain of events that happens related to some of the policies that have been implemented. We're trying to track that and figure out, okay, well, where's the best place to insert some kind of intervention that's going to be most beneficial for everyone and help unclog that housing system a bit. So, yes.
I just would like to respond to this. Sorry to mention your name. Steve, I would like to respond to Steve's comment. Well, I know I cannot speak on behalf of the entire city, nor can I speak on behalf of the other elected officials in this room. I'm fairly confident we all hold the very same beliefs in which Rutland City, we're very aware there is an economic hit that we take when the hotel program exists in the capacity in which it does right now. And it is not something that we are ignorant to. It's something that comes to the table every time we're talking about the economic vitality of our city. But I believe when we're talking about the conversation here tonight, we're talking about what Megan and what Chris are looking for us to do. It's what can we do as a community and how can we support them in their work. And what has been coming back into my mind, Steve, since the very beginning of this conversation was your observation of the young boy with the Doritos and the hot dog and the Mountain Dew. I have family members who live in the hotels. I have family members with children who live in those hotels due to the circumstances that they could live that have brought them to that point. And when I heard you say that, it made me picture my own niece. It made me picture my cousins, the very same family that I have that is living amongst us, working amongst us, and they are they're in it. There's no other way to say it than they are in it. I believe what Megan and Chris are looking for here tonight is what can we, as inspired members of the community who want to make a difference, what can we do next? And with that idea, I'm wondering if Megan and Chris have looked into grassroots community efforts specifically around providing healthy and nutritious meals to individuals within these hotels, meals that may not require a microwave. I understand Companions of Wellness meets a need with one brick and mortar location, but I'm sure, as Tia may have encountered in the past, there's lots of folks who are homebound. What can we do to provide meals like that? Is there any sort of groundwork that has been laid for civilian community member collaboration and work with you guys? As evident from social media, we have a very active, engaged community, people who want to participate, who want to do the right thing. What have we constructed? Are we looking into constructing ways we can have the average community member bring a warm plate to make sure no one's eating Mountain Dew and a hot dog and Doritos for dinner every single night for their entire childhood?
I'll give you a response to that. You may not like it, but I want to say, 10 years ago, when we rolled out Project Vision 1.0, if that question came from a community member, it would have turned back and would say, that's your job. Find and improve. That's how Project Vision worked 10 years ago. I know you're vice chair or co-chair. That's how Project Vision worked 10 years ago. If somebody had an idea, they didn't point to somebody else and say, hey, you should do this. Project Vision worked 10 years ago because somebody said it and 5 other people in the room said, yeah, I'll help you do that. And I'm not sure if that's Megan's and my job to coordinate. If it turns into that is our coordination, then so be it. But we already have an infrastructure built that's been tested and worked. And that was Project Vision, and that is Project Vision, to create those opportunities to serve where the community can serve community. So that's not being a flip response, but if I had been standing in front of y'all 10 years ago, it's absolutely what I said 10 years ago. And do I own a piece of that now? Absolutely. I'll give you an own personal experience where I didn't adhere to what I would have done 10 years ago. I was in the Price Chopper. It was in the evening shopping, and we were out of bagels, so I went to the bagel just in case they had a half a dozen left in the word, and there was some cat, homeless dude, literally, digging through the trash right near the food court in Price Chopper. Digging through, pulled out an empty bag of Doritos and tore off a piece of foil. Because of my family's lived experience, I knew exactly what that cat was doing. He needed foil to, say it. Yeah, he needed to cook. He needed that foil to either burn so he could inhale, which is most likely it. That was my lived experience. And then I saw him, I'll say it outright, starting to ogle women walking out of Price Chopper right at the food court with their daughters, getting rather excited in himself about it. And I saw him, I'll say it, I saw him, at best he was taking a picture down his pants. He was taking a dick pic. It was clear. What did I do? I went and found the manager. She got security, told to leave. 10 years ago, what I would have done is I would have walked up to that guy and said, come on, that is not the behaviors that we want in this community, man. You need to stop. I would have found the right language for that audience to tell him that is beyond our community norms. Those behaviors are not done in this community. And I think that's going to have to be part of the community solution also, is when we see somebody doing something that does not uphold the standards and the norms of our community, we've got to call them out. And will it result in an FU? Possibly. But it also might result in somebody saying, oh crap, man, I'm sorry. I screwed up, I won't do that again. Those were some of the experiences we had 10 years ago. And, I mean, come on. Sharon Davis was in a movie 10 years ago, for God's sake, about rebuilding a community. Right? And everybody played a role in that response. I don't know how we get to the point of creating that same type of culture in the community, because it is, it's difficult. This is a population whose behaviors that they are exhibiting is not the type of behaviors we dealt with at any time in the past in this community. You know, and this is not just me. I've been asking business owners throughout downtown, business owners along Strong's Avenue, individuals who I just come across and speak to, that the behaviors we're seeing right now, that's, I think, what's giving the community a sense of loss, and without being able to create a strategy to respond. This is something that the behaviors we're seeing are New York City type behaviors. Roger.
Changing the topic a little bit. So earlier you talked about how so much of the money that was spent by the state to support the shelter first idea went to the pockets of the hotel owners.
Yes, sir.
I don't know if there's an opportunity for the two of you to look into ways that we could divert a portion of that to supporting services locally, and whether that's coming from the state level, saying, all right, you know, every town, if whatever number of nights you have, you're getting $10 per voucher night to support services, and you know, talking about tip of the spear, somebody to be a point person. It sounds like the number of nights that we have in Rutland City or the Rutland area, I mean, that could totally support it. $10 a night per voucher night, I mean, that could support one or more full-time people to be that point person, to be a municipal employee doing just that, being the tip of the spear. Or going to support all these other services that are going directly to the people. And if we can't see that from the state level, where they just say, okay, you know, a hotel's getting $80, $10 of it goes to the city, is there a way for the city to come up with a fee or something that says, okay, hotel owners, if you're accepting this program, there's going to be a fee for you, charge per voucher night that comes to us, is that something we can do legally? You know, this isn't my wheelhouse. I don't know if we can do that through the charter or ordinance or the bylaw and zoning or anything like that. But if there's a way to try to divert some of that to go towards the support that we need, that would be great.
Yeah, completely agreed, and we will be investigating, what the city has for leverage with the hotel and voucher program, and ways in which the city might be able to make it a little bit harder, or a little bit, make the hotel and motel owners less inclined to raise their hand if there's other certain, strings that end up being attached to that. So I appreciate that. Thank you.
I don't want to make them less inclined, right? I mean, because that is a service that they are providing. Obviously, it hasn't gone very well in a number of examples. But if we had the capacity to make sure it had been done well, we wouldn't be looking at this with the same negative view that we are today. So over the last 4 years, the number of dollars that have been spent on that, if they had been diverted to go towards the supportive services or diverted to go towards building actual houses, right, we could have ended up somewhere different, right? So we wouldn't be looking at these hotel owners like, we wish you hadn't have supported those people, but we would have had maybe a different outcome where we would be proud of what we had done as a community.
Well, another way we could have a different outcome is compel the legislature to ensure there's proportionality with respect to where the housing emergency shelters are located, and that includes motels and hotels. That one of the reasons you brought up rightfully is there any way to get money to help out the providers is because we are overburdened. The state of Vermont did not send 20% of their workforce from the Burlington office daily to Rutland to support the percentage of individuals who would right now be in Burlington if not for the hotels. So while I agree with you, absolutely, on all your points except for one, and that's we also need to change the dynamic, the number of rooms there are in Rutland, because there is no guarantee that after this winter, which they said is going to be the same as in past winters, there's no guarantee it's going to be different in 2026, 27, 28, and there are some individuals on the task force right now that want to continue the motel program indefinitely. And Rutland is not served by that, and their clients certainly are not served by that. I need to go through the quality also. I started with the Cortina, but to your point, there may be hotel owners that need to be taken offline because they are perpetuating a very real problem and not playing a role in making lives better for the people who are staying in their places. If they were that magnanimous and filled a service need, by God dang golly, they'd be vacuuming and shampooing those common areas on a regular basis instead of having people's feet stick to the ground where animals were allowed to go to the bathroom because they were cleaned up. So they're not quite as magnanimous as they would have you believe during their testimony, which I have watched that as well.
Just so you know, the same operators in Rutland own 5 units here in Rutland Town, Rutland City. They also own 2 in Derry, Montpelier. They own 2 in Brattleboro. So the same operators has got most of the market. And making lots of money.
And you know what? I hear you. But it's still the state of Vermont that has created that policy, and they have changed, as I said in front of you guys before, they changed their business model to accommodate for the changes in state policy and how they were going to get paid. Go ahead, Senator.
They have building codes, they have health codes that the state pushes forward, and none of the places I've been in meet that. So, is that the city's responsibility?
Nope. That's what the chief was alluding to when he spoke to the public health piece for the clinic, was they've emasculated Rutland City Building Inspector's authority to do a great deal. Likewise, fire marshal. Help. Yeah. So a lot of the tools in our toolbox that we use, we as a community used during the subprime crisis of 2008 to manage vacant multifamilies, those tools have been taken away from the city's toolbox.
Yeah, certainly with respect to the health inspector, with respect to the building inspector, the mayor has had our building inspector and zoning officers go to the hotels and inspect the rooms, and they have shut down rooms until they've come up to and met the code before they could be sort of reoccupied. So, but as Chris mentioned, you know, there's unfortunately the state has done a lot to sort of stack the deck against the municipalities. You know, I think through legislation they were. Effectively, you know, when the hotels became shelters, the city lost any rooms and meals tax. You know, there was no compensation made back to the city because the city was absolutely impacted by the hotels essentially becoming shelters. There was a big financial impact, a real burden on the city, and with, you know, again, without sort of consideration from the state. But as I said, the city, though, if you remember at one point when Mayor Lair was in office, did shut down the Quality Inn. And that was because of various code violations. And at the time, I believe that the state fire inspector was also with us on those inspections. But again, the city has certainly you know, done everything it can do to ensure that the shelters are maintained and that are fit for human occupation. You know, and unfortunately, I think we've all seen that. You know, certainly, it's not always the case. It's pretty disgusting.
Well, Rutland Town, the largest facility, and that's under state jurisdiction. They have no zoning and no offices in that town. It's a small town, so the state does it all. So the health department, it's the first time they showed up in a year in the facility when they closed half the rooms down.
You got a question or comment back here? Yes, ma'am.
It's a comment about, it's wonderful all of these services we want to give these people, and we want to hand them food, we want to hand them this, we want to hand them that. What can we do to make them accountable? They are the ones that are stealing stuff off our porches. The policemen are running ragged around the city trying to keep up with it. When do we say enough is enough from them?
Great question. That's part of when I said I indicted myself about not calling someone out.
We call the police department and they come all the time. We are constantly having issues around our house. And my house is right next to the Loretta home. How is that not going to move that problem there?
It's a great question. And before the Loretta home deal is done, there needs to be significant community outreach to the neighborhood. But it would, under its, you know, current structure and proposal, it would have 24-hour staffing, and it would be kids and families only. So it would be, the hope would be, but it's going to come down to the wraparound services, and it can't happen without all of those supports on a 24-hour basis.
But even beyond that, how are we supporting the police? How are we supporting property owners who have their properties trashed? They can't evict people. They can't get. There are houses out there that people just don't want to rent anymore. You know, it's not just giving things. It's expecting something back.
Yeah, accountability. Has to be part of whatever solutions we come up with. If the accountability is you need to get a flu vaccine, that's still being accounted. It's a start. And, you know, as easy as, if you will, picking up garbage. You know, seeing someone walk away from a plastic bottle that's empty when there's trash there and someone else is expected to do it. It's just the basic soft skills that I don't know how to crack at right now. And that's one of the things that, you know, we all need to work on before the strategic plan is done in a year and a half is, if you will, how to modify the behaviors of the people creating chaos in the community. That's what it comes down to.
And I know it may seem like the strategic plan is this far off thing, and there are these issues right now that need to be dealt with. They're so connected. And that's why that strategic plan, that big picture view is helpful, because yes, the police department is overburdened. They're overburdened with calls that aren't necessarily police issues. Part of that reason is because the service providers are overworked, understaffed. So, you know, you go to the issue of, okay, let's address where, how can we help the service providers be able to serve these people so that the police department isn't getting calls about mental health issues or substance use on the street. And then when you reach the social service providers, they say, we'd like to hire people. We can't get people in who are licensed. When they do come here from other states, they can't find housing. So then you move to the housing issue, and it becomes this giant connected thing, and that's why a strategic plan is so necessary. We could do things here and there, interventions here and there, but if all of those interventions aren't working towards one goal, it's going to come out a different mess than what we're dealing with currently.
I hope we also do some honest practice reflection. In Chittenden County, out of the motels there, we rehoused over 300 households from motels directly to permanent housing. Nothing like that has happened in Rutland County. And that is the responsibility of whoever took the contract to provide housing navigation services in the motels, right? We knocked on doors. People worked in parking lots. They had client meetings in motel lobbies. They worked out of their cars. Just this year, since January, 34 households moved into permanent housing. And that's in a county that has a vacancy rate less than 1%. That's the definition of a broken real estate market. Rentals usually are about 5 to 6% vacant at any given time. That's how you get normal churn of people leaving and moving into communities and starting new jobs. Less than 1%, 34 households. The work wasn't done here, and I know that the strategic plan is meant to look forward, but my gosh, if we don't at least do some honest practice reflection about the job we did, we will have missed something huge.
Thank you.
Thank you.
Do we know the answer to that question?
What question?
Who is responsible, or who was the person responsible for managing or overseeing that contract for the hotel housing? How did you put that?
So the state issued a contract to provide housing navigation for people staying in motels. That's part of the services that help people get from shelter to housing.
Yes. So who was the partner, or who signed off?
I honestly don't know.
That's my question.
That's the question. And this, I know that there are a number of organizations that have housing navigators in Rutland County. I can't speak to how those navigators are specifically working or what they've specifically done. And that's a question we need to get answered. And if there is an organization who has been failing in their contract with the state, then that as well needs to be pointed out in whatever documentation we come up with. And that, it certainly won't wait till April 26th to say somebody dropped the ball.
Yeah.
And we have to find out if somebody actually was carrying the ball to drop.
And I just want to get back to the food question. For food and nutrition services. So the outreach care team, or we call it the OCT, was asked by the Vermont Farmers Food Center if we would, I guess they lost the person that was delivering the meals, and so we thought we could help, even though it's not really our primary concern. But I get the impression, and Dave, correct me if I'm wrong, that they would like to expand and have more food. These are frozen meals, but they're home cooked, pretty, out of wholesome ingredients. They would be good, nutritious meals. If anyone here is interested in maybe talking to, I can give the contact at Vermont Farmers Food Center, and if anyone's interested in having a conversation about nutritious meals to people who need them. I think that's something that I would be happy to facilitate for you, connect you to.
It gets better than that. We had a Rotary meeting this Monday, and our speaker was a lady by the name of Kelly Dolan. She's from Salvation Farm, and that's an organization upstate, but they come down here where they go to farms after the harvest is done, and they glean the stuff that's left, and they make some of that into those types of dinners and stuff like that. I don't know why, it's because I thought, they get mashed potatoes and certain, for schools and stuff like that, so there's another avenue.
And Steve, that is pretty much what the Vermont Farmers Food Center does.
They're
Vermonters feeding Vermonters. So it's local farms,
We need
food
one
from.
key piece of equipment, which I worked on for a while, the Food Coalition. We need a flash freezer, a major flash freezer, so they can pack the stuff ahead of time and store it.
Believe it or not,
That's a
that is one thing that was not
$15,000
overlooked by the state early on. They did provide nutritious meals to those housed in the hotels at the time through, locally with Meals on Wheels. And again, they're providing meals to the elderly, those that are, homebound, and I believe they do focus on nutrition. And majority of those meals were actually discarded and never eaten. Again, that was early on. So it is something that was not overlooked.
30 frozen meals in tins, and we try to distribute those, and people are like, I live on the street, I can't, it's useless to me, or because it's in a tin, I can't put it in my microwave if I happen to have a microwave. It's like, but because of some other regulation somewhere, it has to be in a recyclable container.
Recyclable container.
Yeah.
That's a state.
So again, there's like little things that pop up, but I'm looking at frozen blocks of, red lentil dal and all of this. This week, of 28 meals I delivered, within 3 days I was back and 26 of them were gone. So that was good, but there was that week when the freezer was an oven and it was pretty horrible.
John. So we're past 9 o'clock. I'm wondering, is there a way for people to get a hold of you easily if they've got additional questions, comments, suggestions, or is there a way to kind of keep up with the work that you're doing?
There's not necessarily a way to keep up. Like, there's not a web page on the city's website where you can go. I have contact cards I can give you with my information. The only other way I would suggest to get a hold of us is there is on the city's website a community feedback form that has questions people can go on there and answer, and you can choose, it's anonymous, but you can choose to provide your contact information so that we have it and can get a hold of you.
What about those sign-up sheets?
And the sign-up sheets too, but that's, that will give you our information, but not so much contacting us. So I guess on the sign-up sheet, if you sign up and you want to put like a star next to your name, if you want us to contact you, that could also be a way for us to know who we would need to reach out to. We are going to, get in touch with some of the people in the crowd here who have indicated that they're definitely people we need to be talking to who are on the ground providing those services. And I guess just to wrap up, I want to say I share your frustration. I know that there's a want and a need to do things right now, and we're happy to help investigate those situations in any way we can. The point of this meeting was for us to hear what are the concerns that the community has, what's top of the list on your mind. And so while we may not have answers for everything here tonight, we've just begun this work, and quite honestly, I wouldn't trust us if we had all the answers here tonight, because they probably wouldn't be, probably would be no meat to them, right? So, but we have heard a lot of the things you guys are saying. I'm going to go home and write all of this down, but we will be, looking into things like, can we divert some resources from the hotels to other programs that are having an impact on serving this community? How can we impact the public health, the public health issues that are arising related to this issue? Will that lead to some, engagement of the community and community groups who are working on the ground? On our part, potentially, it could lead us there at this point in time. But we'll also, be looking for things like who's going to be a point person here in Rutland. So I really appreciate all of the feedback you guys have given us tonight. All of the perspectives are super important for helping make sure that we stay on track investigating issues that are important to the community and also helpful towards our ultimate goal of creating a plan.
And also, Pastor John, thanks so much for giving me the term practice reflection, because that, I have it circled, I have it underlined, and it's all about, from my perspective, learning from the successes of others and not repeating our own mistakes. Senator.
So when you go home and write those questions down, is there someplace you can put them so people can access them?
You know, I think the more and more questions we're getting about this, and we did kick the idea around with the mayor earlier on, maybe there would be some use to have some type of landing page for these efforts on the city's website.
Like TV.
We'll investigate some ways and maybe where we can have a homepage where information could be shared.
Will any of these be advertised if you do this again?
Yeah.
The only way I found out about this was I happened to watch Board of Aldermen meetings. I could not find any information about where this meeting was being held. I had to go back and watch the video again.
Agreed.
It needs to be
That was our
posted somewhere so we can have a larger group of people brought into this.
That was our conversation this morning. That's why we decided, even before we saw what the turnout was going to be, we were assuming it was going to be low, and that we've already decided to have another one of these forums next week. We're going to be posting flyers, in locations like on the city hall and in supermarkets, gas stations, whatever we can to try to, and then you guys can also help spread the word. Hopefully this will be the location again, but we have to double check and make sure that it's available. But Thursday next week.
Yeah,
I want to
let's
get
just
the
say
date right.
We're planning on Thursday next week, and I would have said the same as Megan 10 minutes ago. We're going to be someplace next week. We got to firm up a place. So, but wherever it is, whether it's next week or week after, it will be well advertised, posted, all that neat stuff.